So we have Albuterol for our presentation, and we have Hannah, Ashley, Jess, Pa, and Victoria working on it.
So albuterol's generic name is albuterol sulfate or salbutamol. It goes under a couple different brand names, including ProAir Respaclid, Proventil HFA, Ventolin HFA, ProAir Digihaler, and ProAir HFA. The drug classification is a beta-2 adrenergic agonist, also known as a bronchodilator, and its drug pregnancy category is C.
So, NCLEX question number 1. A nurse is training a group of students about the mechanism of action for albuterol. What statement made by a student indicates comprehension? Albuterol targets alpha-1 cell in the bronchial smooth muscle to promote bronchodilation. B. Albuterol causes bronchial smooth muscles to contract to force air into the lungs. C. Albuterol promote clear airways by inhibiting mucus cells in the submucosal gland producing sputum. Or D. Albuterol targets beta-2 cells in the bronchial smooth muscle to promote bronchodilation. And the answer is D. Albuterol targets beta-2 cells in bronchial smooth muscles to promote bronchodilation. So the mechanism of action, albuterol targets beta-2 androgenic cells to inhibit hypersensitivity mediators released such as mast cells and relaxes the bronchial smooth muscle. Essentially, it just targets the B2 cells receptors in the respiratory tracts and stimulate them, which increases the cyclic adenosine monophosphate production, which is used to help stabilize mast cells and inhibit histamine that also cause the end result of bronchodilation. The therapeutic use for this drug is to prevent and treat bronchospasm, acute or severe, and is also short-acting. Medication administration. For the route, there's different types. So the most commonly used is the meter dose inhaler, aerosol, and powder. Other options are also tablets, serum, and nebulized solution. For this presentation, we have the table of common dosage, but we'll talk mostly about the inhaler because it's the most common use. For adults and children, they are usually just 1 to 2 puffs every 4 to 6 hours as needed, but you should not exceed 12 puffs in 24 hours.
So for the principles of pharmacology, we have pharmacodynamics. Basically, just albuterol causes bronchodilation and increases bronchial reactivity to manage asthma or other chronic obstructive airway diseases. For pharmacokinetics, we have albuterol will directly affect the bronchial smooth muscle upon inhalation without initially entering the bloodstream. And if albuterol enters the liver, it's metabolized very quickly. So that's why administering albuterol directly into the lungs is the best approach to bypass the first pass effect of metabolism. And then lastly, about 70% of a dose of albuterol is eliminated through urinary excretion within 24 hours. And for pharmacogenomics, we have that albuterol stimulates beta receptors in the body, specifically beta 1 and 2. There's multiple polymorphisms in the adrenoreceptor, in the beta adrenoreceptor gene, and some of which have been associated with reduced bronchodilator response to albuterol in both asthmatic and non-asthmatic children.
The physiological effect of albuterol is promoting smooth muscle relaxation and inhibiting mediators release, such as mast cells. Also, this effect is also known as bronchodilators. Some side effect of albuterol is breathlessness, short wheezing, chest pain, tightness, agitations, confusion, dizziness, headache, upset stomach, throwing up, shakiness, throat irritation, tachycardia. Next. Albuterol may increases anxiety because that's one of its side effects. Severe side effect isn't common, but it does occur. This may affect mood disorders such as anxiety and depression. This can be managed by decreasing dosage or changing the delivery method. For example, adding a spacer to inhaler or using inhaler instead of pills. It's best to talk to your care team or provider if you have trouble tolerating the side effect. Next. With overuse of albuterol causes a beta-2 receptor to not react to any stimulations, losing its bronchodilators effect. These usually that according to the poison control articles, albuterol is a safe drug. When used as recommended by the provider, there are no long-term side effects when used appropriately, but if overused as stated, their asthma symptom may worsen and can also lead to dependency. Many studies have shown that while using albuterol while pregnant, it is safe, but it could actually worsen the pregnancy if leave untreated. If they leave the asthma, if the asthma is untreated or not controlled, it could lead to more complication to the mother and baby. For social economic, albuterol prices increases when the FDA banned chlorofluorocarbon CFC propellant in albuterol inhalers. And then according to the CNN, there has been a shortage of liquid albuterol because of the Acorn, a company of which they filed for bankruptcy in 2023. And then research showed ladles spiritual and culture's bias against using albuterol. However, studies suggest that African American are less likely to adhere to their medication due to a strong religious belief, and they also have a higher likelihood of not trusting physicians.
So the application of butyral. For the nursing part of it, nurses should provide basic standard level of care such as nursing assessment, evaluation of patient outcome, monitor for signs and symptoms, the effectiveness of the drug, assess for allergic reactions of using the drug, assess for respiratory status, note any changes, make adjustment to the nursing care plan, understand the drug side effects, and also understand indications. Also, the big part is being the patient's advocate, collaborate with the interdisciplinary team to improve the patient outcome. So for the drug standards, we should only take it as its intended use. For legal regulations and healthcare policies, nurses should always review their healthcare policies. They need to review if special care is needed to administer the drug and if any special certification is needed. You also need to obtain consent, verbal or written, from the patient. For the patient's right, they have the right to refuse care or refuse medical administration, to the right to receive a basic standard level of care, and also the right to be informed.
There are a few racial and ethnic differences in response to albuterol. So here there's a research done with Americans, and in it, study showed that Puerto Ricans, Mexican Americans, and African Americans who have asthma will show a higher morbidity rate when compared to European Americans due to them having a below average responsiveness to short-acting beta agonists, low like albuterol. And there was also a study with when they were testing the three groups with association of inhaled corticosteroids with the use of albuterol. And in it, it showed that Mexican Americans had the highest BDR when compared to the groups. And there was also a study shown that it could be because that most people with African descent have a genetic mutation, which make them less responsive to albuterol. The gene is known as NFKB1, and the gene is responsible for smooth muscle response in the lungs. So age and sex differences to the response of administration to albuterol. So patients under the age of 4 shouldn't be using albuterol unless like a provider says so. Um, so as mentioned before, like if a patient who's been diagnosed with asthma since childhood, they're more likely to develop like a less reversible airway obstruction and later lower response to the respiratory medication. And if an elderly patient uses asthma, with asthma uses albuterol, then it could lead to severe cardiac and central nervous stimulation. And beta-2 androgenic agonists like albuterol, it causes dilation in the forearm resistant vessels, but women are higher sensitivity to the beta-2 receptor stimulations than men. So if women use albuterol, then they'll have less forearm vasoconstriction.
NCLEX question number 2. A nurse is teaching a client about albuterol. The nurse should educate the client to observe for which of the following adverse effects of the medication. A, heart palpitations, B, dermatitis, C, diarrhea, or D, confusion. So the answer is A, heart palpitations. When monitoring a client taking a beta-2 adrenergic agonist, it is important to watch for heart rate, for chest pain, or heart palpitations. So for drug interactions, there are some drug-drug interactions with albuterol. This would include tricyclic antidepressants, monoamine oxidase inhibitors, beta blockers, diuretics, digoxin, and albuterol can cause cardiovascular problems or ECG changes. So that's also something that's important to look out for. And it should be taken before inhaled glucocorticoids. Examples of those would be Qvar, prednisone, Flovent, or Flonase. And drug-food interactions, there wasn't really a whole lot, except both oral and bronchodilators and caffeine will stimulate the central nervous system. So it's important to not intake too much caffeine when taking albuterol.
So NCLEX question number 3 is, a nurse is teaching a patient about proper administration of their albuterol inhaler. Which of the following statements by the patient indicates teaching was effective? A, I must hold my breath for 10 seconds before I administer the albuterol to ensure it all reaches my lungs. B, my albuterol is meant to be a long-term solution for preventing my asthma. C, I will take my albuterol inhaler before I take my Flovent inhaler. And D, if my prescribed dose does not work, I will take more puffs as needed to treat my asthma. The correct answer is C. Albuterol inhalers should be taken before inhaled glucocorticoids in order to properly open up the airway and allow the glucocorticoid to reach the lungs.
So some nursing responsibilities when the patient is taking albuterol. The nurse will assess for therapeutic effects if the patient is taking it. These will include there will have decreased dyspnea, wheezing, and respiratory secretions. They'll also have relief of bronchospasm and wheezing. The patient will have reduced rate and improved quality of respirations and pulmonary function. They'll also show reduced anxiety and restlessness. And then the nurse will also obviously need to assess for adverse effects. Those were mentioned previously, though. Some of those adverse effects would be tachycardia, agitation, etc. And then also, just when the patient's taking albuterol, there's some precautions that need to be taken. They might need to look more into it if the patient has cardiovascular disease, diabetes, hypothyroidism, hypokalemia, or glaucoma, especially with cardiovascular diseases, because albuterol can affect the cardiovascular system. And some monitoring parameters and labs for albuterol include blood pressure, heart rate, forced expiratory volume and peak flow, central nervous system stimulation, serum potassium, and serum glucose.
So some radiology that you may expect to use with albuterol is a chest x-ray. You may see enlarged lungs or air pockets, and a CT. Before albuterol, you'll see some narrowing of the airways as seen in D, E, and F here. And after albuterol, you'll see the size return to baseline as seen in A, B, and C.
So telehealth is where we are able to give healthcare to a patient online, like through the phone or through a video. And then informatics is where we use technology, biomedical data, science research, and we use that to improve human health. So in our scenario, it's where kind of like where with pediatric asthma patients, they're able to receive more accessible medical health care through a like video-based telehealth. And here, like when the patients talk to the provider, they're able to self-manage and control their asthma symptoms better. And the provider is able to assess the patient over the video using some questions like asking about their symptoms of asthma, like if they're breathing well, if they're coughing. And then they've been doing Bluetooth spirometers and smart inhalers. Like the inhaler can sensor the medication, monitor how much the inhaler is used, and it'll be sent to the patient's smartphone. And the data can be sent to the health team where the specialist can, possibly change the prescription or dose with the patient. And companies are also wanting, pharmaceutical companies are wanting to study the chemical manufacturing process of albuterol so that it increases the availability to allow patients to get it more. And so telehealth and informatic nursing really helps patients with something like asthma or COPD to use medications like albuterol to have it more safely and accessible. And asthma patients, it's shown that even when they're like face to face with providers, compared it to video-based healthcare, it's still, they have pretty similar asthma control. And so that concludes our presentation. Thank you for listening, and here's our references.